नमस्ते. What is dual plane breast lift? Dual plane breast lift है क्या? Nowadays we are doing a lot of breast lift procedures जिसमें implants use कर रहे हैं and we are using this amazing technology called dual plane breast lift जो मैंने लंदन में सीखी है and it is creating amazing breast lifts with enlargement using breast implants. So मैं आपको explain करने की कोशिश कर रहा हूँ. Let me try on this screen how it is going to work. So let us look at what is dual plane. Normally जो breast augmentations हम लोग करते हैं, so they are either behind the muscle. Now this red color is the pectoralis muscle. ये pectoralis muscle है, implant इसके पीछे है and muscle is completely covering the implant. So this is called submuscular. If the implant is above the muscle, it is subglandular. If it is between the muscle, it is subfacial. Now dual plane is something very special. In dual plane, muscle is released from here, muscle is separated from here and muscle lifts up. So basically what happens is as this muscle lifts up, breast को भी अपने साथ ऊपर लेके जाता है. It starts to pull the breast along as well and some of the sagging is better controlled. So dual plane is also of three types. How much of muscle is cut? So if we do minimal muscle cutting, type 1, then type 2 and type 3. This is not important. We are largely doing type 2 of dual plane. Reason is we are doing breast lift surgery plus dual plane breast augmentation. So how do we do this? Please note this very carefully. थोड़ा सा technical है, you might get confused but keep noting. So example, this is a patient जिसमें we have to lift up the breast. So we have to basically make the breast like this with a nipple here. So we want to lift up this breast to here. So what do we do? We can't just ऊपर ऐसे तो लेके जा नहीं सकते. And if we put an implant, then augmentation will only be here. So the breast will only be augmented in the lower part. Therefore, what do we do? First step, we do a dual plane breast implant. So we make a cut here like this. We make a cut like this and put the implant in the dual plane by releasing the muscle from here. All along here, we separate the muscle. And the muscle which is like this is the pectoralis muscle, is cut from here till here. So its upper attachments, ऊपर की जो उसकी attachments है, they are all intact, and यहाँ से it is separated, and therefore this muscle moves up. So as we see here in this the muscle now moves up like this. So this muscle is moving up here. Then we do the dual plane lift. After the implant is in, everything is closed around the implant, and then we remove extra skin from here. We remove extra skin from here, lift up the breast, and then this stays there. After that, we do internal bra technique. We put a mesh here like this and fix the mesh to the bone below, and this becomes a layer. So the mesh stays like this and the implant can't fall down. So we do the dual plane breast implant, then we do the breast lift, and then we do the internal bra. And by this technique, we make sure that every patient has a much longer lasting result. This is a unique technique. Only 2 or 3 people in India are doing this currently. And it is revolutionary because it gives you very high breasts, perky breasts. You don't need to wear a bra also. And with the internal bra support, you don't even need, for years, maybe even 10 years, the breast will stay almost like that.